Lichuga today, and we're going to be talking about sports-related injuries. Hi, doctor. How are you?
How are you? Good morning. Good afternoon, actually. Good afternoon.
My first question is, what is a concussion, and does someone have to be knocked out or lose conscious in order to have a concussion?
A concussion is brain trauma secondary to an injury. And this injury can be directed to the brain, to the head itself, but it can also be another way of injuring the head just by an impulsive force that is not directly into the head. So that is what the type of injury. And it causes a concussion when there is an abnormality in the metabolism of the brain because of this injury. And there are many ways in manifestations of this injury in a person that not necessarily have also loss of consciousness.
Now, what are some of the symptoms, and how soon after injury occurs someone might see the symptoms or experience?
The symptoms might occur immediately, but they can also linger around for a long period of time and not manifest entirely at the very beginning. Symptoms such as headache, dizziness, a person who is disoriented, a person, for instance, who has poor memory, unable to concentrate, which happens to the children very frequently. They can also have something like a blank stare or being stunned. They can be disoriented, they can have a lack of memory, a lack of balance, proper gait. Those are the types.
Now, how should sports-related injuries be evaluated, and do you think a neuropsychological test can help?
Yes, depending on the severity of the case, the child can be evaluated. First of all, there are guidelines. If the child is playing sports, the coaches already have guidelines that they need to pursue. They have a sideline evaluation first, and depending on the characteristics or severity of the symptoms, this particular individual should actually be sent in to the primary provider or to an emergency department, depending on the severity of the symptoms.
Now, how long is the recovery process?
It is variable. It can take only a couple of days, and the person will be fine and ready to go back to their regular activities. But it can be several weeks, and it can be several months in some instances. There are individuals that can linger with severe headaches, with lack of memory, for a long period of time.
Now, do you think a person should wait to fully recover in order to return to play sports? Because children sometimes think they're very strong and they're recovered.
Definitely. No. They have to have an evaluation, a proper evaluation, before they are able to return to learn first and then return to play. Because the children should have a rest of learning also. And then once they're able to go to back to school and learn, then they should be able to go back and play.
Now, you already said what the symptoms are, but once again, what the parents should be aware of, what kind of symptoms they see?
Yes, if their child continues to have a very severe headache, if they are not able to concentrate in their regular work, if they feel that the kid is disoriented, and that they have vertigo or dizziness and improper balance, those are things that the parents should look at.
Thank you so much, Dr. Lichuga, for the very helpful and informative interview. And that was all for today. I'm Lucia Dragos for QPTV.